So I'm just going to give you a bit of a taster of what the Hub's about, what it's doing, in the hope that it might make you reach out and make contact with us and maybe come and visit one of our monthly half-day workshops that we run at the Hub to find out more detail. Now, some of you will know me from my other day job as a clinical lead for a dedicated psychological therapy service for ex-military personnel. And it was partly because of that within the first few hours of the incident, I got quite heavily involved because obviously some of the expertise we've developed over the years is the psychological reactions to improvised explosive device type trauma. One of the best things for me on a personal level is the fact that I've got to meet some colleagues, other professionals, through doing this project that I would otherwise not have had the opportunity, and especially to some of my colleagues in children and young people services, because often the two services are kind of siloed away from each other. And I'm here speaking today on behalf of the Hub, but I do have a counterpart called Claire Jones, who is the children and young people's clinical lead at the Hub. So if you've got a specific CYP issue, we've got dedicated leadership at the Hub as well. So the Manchester Resilience Hub is staffed by staff from Pennine Care Foundation Trust, Greater Manchester Mental Health Trust, North West Boroughs Foundation Trust and Central Manchester Foundation Trust. So it really is a bringing together of clinical staff from around the network. So to set the scene, just talking about some of the numbers. We still don't have exact figures on all of these numbers, only some of them, so I'm just going to talk you through some of these. We estimate, based on the number of tickets sold, the number of staff on site, the number of people who responded, who came to help, we're talking about up to about 21,000 individuals who had a direct connection with the incident on the evening, 22 of which were killed. We have a list of more than 300 individuals who were injured. And those injuries, and again, just to help you think about the kinds of people who might be coming forwards for psychological therapy, they involved penetrative shrapnel injuries, there were amputations, there were head, brain and neurological injuries, we've got a lot of burns, spinal injuries, and basically mobility issues and a lot of life-changing injuries and disfigurements. And then we had up to 2,500 emergency service personnel involved in the response straight away. So who is the Hub for? It's for everybody who's directly been affected, so pretty much everybody who I captured on that slide. And it includes everybody in this room because we're also a resource and a bringing together of information where you can phone up and get advice. You might just want to know, did something actually happen that night that your client is telling you? We can probably verify that. You might find somebody who says they observed a lot of material on the evening, but they're not known to the police. We can help put that individual in touch with the police because they might be an important witness, etc. So the screening process that Paul alluded to, we decided that it was really important to do an outreach, an assertive outreach, not wait until people tipped up at services with their hand up saying I need some help, but actually contacting these individuals saying it's been a number of weeks or been a couple of months since this incident and we're all thinking about you and would like to know how you're doing. And by taking part in this online screening tool, you can basically sort of show whether or not you're showing any signs or symptoms that we might be concerned about and whether or not we might wish to suggest accessing therapy, and we can help you access the therapy. Now, I'm not allowed to talk about money, but because we're doing this on the cheap, which, you know, I've heard all kinds of myths about the amount of money the Resilience Hub's got. We haven't got any money yet at all. There has been a bit of a promise about the Greater Manchester CCGs underwriting just the screening element. So one way of doing this cheaply is doing it electronically. So literally people are getting an electronic PDF invitation letter. It contains a web link, takes them to a web portal. For those of you who are familiar with PCMIS, that's the clinical information system we're using. We've got an algorithm that scores up people's scores and it gives automated responses to the person completing them. So if they're subclinical, they'll get a nice message, you seem to be doing fine, carry on doing what you're doing, but meanwhile, here's a load of digital links of self-help and information that you might find beneficial. If they come back as clinical or high risk, so they might be suicidal, then the hub staff get flagged those cases, and we then outreach and make contact within the first few days to those individuals. They also get sent information about how they can self-refer themselves to IAP services in their area, and we are looking to repeat this 3 months, 6 months, 9 months and 12 months post-incident in recognition that people's needs change. Some people will deteriorate, some people won't improve, and we're quite interested in finding out what's happening to those. These are the numbers. So as of the end of October, we've got 2,500 people open to the hub, of which 500 came to us in the very early days. These were the first few days and weeks where maybe the police were sending us people, victim support were sending us people. We had a lot of these details before we had any premises and before the hub was officially existed. There were some of us collecting this information and making calls and emails to those. And predominantly these were the very affected individuals. Since we've started the screening process, we've had an extra, in excess of 2,000 people come through the screening, and this is ongoing. Now, we mentioned it, the fact it was a ticketed event. Not everybody purchased tickets through the main ticket provider. Some people had bought tickets by cash. Some people had bought tickets from touts. And most of the ticket purchasers bought on average 3 tickets. So we only had 1 email contact for the purchaser, and we had to kind of request that they passed this invite on as wide as they could. So we only actually had 6,500 individual sets of contact details to try and reach this 20,000 people at the concert. As you can see, most of the people open to us are adults, but we have got more than 300 people under 15 open to us. This is quite interesting. At the moment, this isn't necessarily who was at the event, but of the people who are open with psychological difficulties and known to the hub, only about 20% of those individuals live in Greater Manchester. So this is very much a national incident. We've got 113 people affected in Scotland, 54 in Wales, and we've got a number of people who are international, people who actually went to the concert whilst they were in the UK on holiday, and we have been having some helpful email conversations and such like with those individuals. But it is very much a Northern England incident, so just about everybody's from the north. So England and half of the Midlands, it's Yorkshire, it's Lancashire, it's Cumbria. These are the people who are affected. Of the children and young people, we've got 405 5-year-olds to 15-year-olds, of which we managed to have direct verbal contact through our CYP clinicians with more than 300 of them. And of that 304, 60% have required intervention, so facilitation into CAM services, etc. The typical responses, things like phobic responses, fear of the dark because they associate that with the darkness on the evening, fear of crowds, fear of ambulances, anxiety and panic, a lot of separation anxiety, seeking proximity from caregivers, nightmares, bedwetting, lots of somatic complaints within this group, stomach aches, headaches, fatigue, and an exaggerated startle response. And so fireworks was quite challenging for some of these children. 16 and 17-year-olds have separated because in some parts of the country they're captured within the CAM services, in other parts of the country they're captured within the adult services. So again, 223 16 and 17-year-olds are known to the hub, of which we've had direct conversations with about 98 individuals, and that's because a lot of this age group they kind of have email contact with us. They're not that keen on speaking to us on the phone. And again, similar issues. We've got stories of 17-year-olds climbing into parents' beds at night and sleeping there, increased arguments within family systems, under or oversleeping, people with a lot of functional problems, stopping socialising with their friends, not sitting exams, missing college, that type of thing. The adults, we've got quite a lot of adults open to us. Now, this didn't feel right to me when our report said we'd only spoken to 517. So actually, we've spoken to somewhere between 517 and the 1400, but we realised that not everybody was as familiar with the clinical system, and they hadn't been clicking the little contacts button. Those of you who are familiar with PCMIS, they thought that once they were known to us, then they've already been contacted, and therefore they didn't need to kind of capture all of the other activity other than in the notes. So we're working on cleansing the data, but again, lots of trauma symptoms, things that people can't unsee popping in their minds, lots of irritable, angry people. Increasingly, as time's gone on, the cognitive presentation has changed, so we're seeing a lot more of the guilt and the shame coming through later in kind of hindsight, now that these individuals have watched the programs and they're sort of thinking, well, in my day job, I'm a first aider, but I actually fled the scene, and maybe if I'd stayed, I could have saved lives. And we're sort of saying, yes, but you had a young child with you, and obviously that was your priority. And so those kind of issues will be for you to be responding to in your clinics. And we've got a lot of young adults who are in their late teens, early 20s, at university, living on their own, really struggling, and they might be hundreds of miles away from their parental homes. Risk information, I think for me, one of the key drivers for setting up a hub was because we know from following the Omar bombing, the suicide rates within the local community actually escalated quite significantly. So we thought that if we could identify people who are at risk of suicide, we could offer intervention rather than not knowing what was out there. And as you can see, we've got a lot of kind of risky people out there, a lot of people who are very symptomatic, and we've got 120 individuals who, for those of you familiar with the PHQ-9, on item 9, they score a 2 or a 3. So literally more than half the days a week they think about killing themselves. And they're people that you wouldn't necessarily pick up unless there was this kind of public screening event going on. I should say that the minimum data set that we use is kind of IAPT compliant, because we felt that would ease access into mainstream services. So we are using PHQ-9, we are using GAD-7. We're using a trauma screening questionnaire rather than the impact of events because of the brevity. And for the children, we're using the CRIES, and we're also using elements of the ARCADS, just to kind of give us a bit of a flavour of presentation. We have had to kind of advocate on almost 20% of all of these cases, and this is all kinds of levels. We've had like IAP services saying things to families like, oh, we don't do anger management, we're not accepting your referral, and then we're having to kind of go back and say, no, actually this is irritability as part of a traumatic reaction, and then they go, oh right, I get it, okay, then we will see them, and stuff like this. And obviously waiting times is an issue. It's not universal. There are the pockets of the UK that are particularly bad, and a big problem is CAM services nationally. We've done a lot of escalation within that cohort. Commission training, so there's been some trauma skills update training which was hosted at the CBT Training Centre at GMMH at the Curve. That's been filmed, and we're in the process of negotiating a host site for those skills training update dates. So basically there's 2 full days of training that all of you in this room, if you're an accredited therapist, could access. So if you want to email in the hub and get yourself on that kind of mailing list to find out as and when it's available and what the password will be to access it, then do that, because it's not yet hosted, but we're in negotiations as to where that's going to sit. We do have a monthly kind of workshop, 3-hour workshop around the incident and around trauma, and it kind of lets you meet some of the staff. So again, contact the hub, get yourself along to the locker room workshops. We managed to capture some 360-degree video footage of the actual city room, or the foyer area where the bomb went off, as it looks now, in preparation that it can be a tool that you as therapists who might be doing some exposure work with clients can use as part of your intervention leading up to a visit. And visits we can also facilitate on your behalf. The arena doesn't wish to have to liaise with multiple agencies. So if you want to, as a clinician, bring a client to the arena as part of any treatment package, then have a word with the hub and we'll try and get some dates organised. The last bits of activity that we've been involved in, we have assisted Greater Manchester Police with things like the family days. There's been days where families have been invited to get updates as to where things are up to in the investigation, and that's quite challenging. We've obviously, Paul's alluded to these kind of pop-up shops and such like, so we've kind of been doing a lot of I don't know what the right word would be, but we're kind of been considering offers of help and evaluating the usefulness to accessing the client group. Again, some media role around sending out good messages, and I think one of the things that I'm quite proud of, and that myself, Claire Jones and Helen Lambert from the Hub have been very heavily involved in, is with the Wheel of Manchester Emergency Fund. Now this is the fund that's got £18 million that you've read about in the newspaper, that those who are physically injured and bereaved have received quite substantial payouts. And we've fought very, very hard for an acknowledgement around psychological injury, and we've had confirmation that yesterday an application form has gone out to the individuals who are on the witness list, so about 500 individuals who were very close proximity to the bomb. And it's the first emergency fund in the UK that is now going to make a financial gift available to the psychologically injured. And that's me, so I'm going to hand over to Paul Campbell, who's going to say a little bit about treating trauma in primary care settings. Thank you.